I'm Matt Willis, Public Health Officer, with today's COVID-19 update. During the past week, we've seen an outbreak develop at San Quentin Prison. San Quentin is part of our county, but is run by the California Department of Corrections and Rehabilitation. Marin County Public Health stands by to support them at their request. This outbreak started with the transfer of inmates from Chino Institute for Men in Southern California, which is experiencing a large COVID-19 outbreak. Transferring inmates out of a facility that is having a large outbreak is understandable, but risky. When facilities are having outbreaks and there are many people in overcrowded conditions, it's very difficult to find places to isolate cases and quarantine the exposed with the appropriate physical distancing. For this reason, reducing the overall population is a common strategy. Unfortunately, because these inmates had been exposed and infected prior to transfer, there's a higher risk for creating a second outbreak, which appears to have occurred here. Some of the CDCR prison outbreaks have yielded hundreds of cases. There are nearly 4,000 inmates at San Quentin, plus over 1,000 regular staff. And because of the risk of a large outbreak in this setting too, we've decided to separate our accounting in Marin County cases to separate what might unfold at San Quentin with what's happening in our own community. Otherwise, it would be mixed and make it difficult to see the signal of transmission within Marin County residents versus what may be happening in that more sequestered setting that we have very little control over. It's a unique epidemiology happening there. You'll see the numbers for San Quentin listed separately on our website. Again, we recognize the rights of inmates to be protected and staff in that setting and are available to support. We've given PPE, testing supplies, and offer technical assistance and subject matter expertise about the decisions of outbreak response. The facility has relationships with various hospitals, both within the correction system and the other healthcare settings throughout the region, where if inmates become so sick that they need to be hospitalized, they can be transferred. We have agreements that our healthcare system will not be the primary source of care, though we will do our part as resources allow. This situation illustrates yet another challenge associated with managing COVID-19 in vulnerable populations. Most of us have the freedom to practice physical distancing, to cover our face, to make choices about where and when we want to engage. These outbreaks are an important reminder of what happens when people aren't able to exercise that freedom due to the conditions in which they live. So please, where we can, do your part to limit transmission in the areas where we have control. We've seen outbreaks in our own community that have a very different dynamic, that are due to poor choices, like children gathering for sleepovers or indoor parties. By following the shelter-in-place orders, you can do your part to make sure we're only fighting the battles we have to. Again, Marin County Public Health remains available to San Quentin Prison to support them as we face an uphill battle in trying to control the spread of this virus that has really gained a foothold in that facility. So please, stay 6 feet apart, cover your face, and stay safe.